Chairman, we're now live.
Thank you. Good evening, everybody. Welcome to tonight's virtual meeting of the Corporate Services, Commerce and Communities Policy Overview Committee at the London Borough of Hillingdon. This virtual meeting is also being broadcast simultaneously on the Council's YouTube channel, which is Hillingdon London. The purpose of this committee is to monitor council services and their performance within its remit and undertake in-depth reviews and witness sessions on topics, submitting any of our findings to our decision-making cabinet. My name is Councillor Richard Mills, and I'm the chairman of the meeting this evening. Before we start, if I just cover some important online housekeeping for everyone present. We're grateful if you could ensure that your mobile phones around you are kept on silent. Please keep your microphone muted when you are not speaking, and then unmute it when you are able to speak. As chairman, I will call on those to speak during the meeting, and if you wish to speak, please indicate and I will try and acknowledge you. As mentioned, I will call you in the order that I see, and in order for the meeting to run smoothly and enable all members to contribute, I'd be grateful if you could limit yourself to one question and then a follow-up at a time. In terms of technical meeting control, if any councillor is to leave the virtual meeting partway through for a period of time, such as a lost connection, I will continue with the meeting unless we are not quorate, which is 5 councillors. Before we move to the agenda, I'd like to do a roll call of the councillors and others present to confirm attendance. So I'd be grateful if you can confirm that you are present when I say your name. Councillor Bridges.
Good evening, Chairman, I'm present.
Councillor Brightman.
Good evening, Chairman, I'm present.
Councillor DeVille.
Good evening, Chairman, I'm present.
Councillor Goddard.
Good evening, Chairman, present.
Councillor Bliss.
Good evening, I'm present.
Councillor Dillon.
Present, Chairman.
And Councillor Farley.
Present, Chairman.
Thank you. And then the officers joining us this evening, we have Kevin Byrne, the Head of Health Integration and Voluntary Sector Partnerships.
Yes, good evening, Chairman, present.
Mike Talbot, the Interim Director of Corporate Resources and Services.
Good evening, Chair, I'm present.
And Luke Taylor from Democratic Services.
Good evening, Chairman, I'm present.
Thank you. We're also pleased to be joined by 2 external witnesses this evening. Julian Lloyd, the Chief Executive Officer at Age UK, Hillingdon, Harrow and Brent.
Hi there, present, thank you.
And Sally Chandler, Chief Executive at Carers Trust, Hillingdon.
Good evening.
Thank you very much, everybody. We will now move on to the main agenda. So agenda item 1 is to take apologies for absence.
We've had apologies from Councillor Harangi.
Thank you. Agenda item 2, any declarations of interest in matters before the meeting this evening? I take it if there's no interest, then nothing will be declared. Thank you. Agenda item 3 is to receive and agree the minutes of our last meeting on the 13th of October. Does anyone have any comments on those? If not, I take those as agreed. Thank you. And then agenda item 4 is to confirm that all reports in tonight's meeting are held in public. Which then brings us on to the main agenda item for this evening, which is agenda item 5 and our first witness session into our major review, which is a voluntary sector's response to the COVID-19 pandemic in Hillingdon. So, as I say, pleased to be joined by Julian and Sally this evening. I think what would be really useful for us as a committee, and this is the first witness session we have, so it's really going to sort of set the scene and the trend for the review that we're carrying out. What I think would be really useful is if you're able to talk through us a little bit about what you and your organisation do, firstly in normal times, so how things operated normally and your role in the voluntary sector, and then obviously the change and impact that's had on you guys since COVID's been around, and then the impact and support you've had an interaction from the council, particularly the Hillingdon hub setup and the interaction with that, if that's okay. So happy to hand over to you, and again, just for the meeting, that we've received copies of the presentation that you shared with us in advance.
Okay, thanks, Councillor Mills. I'll start us off. So I'm Julian Lloyd, Chief Exec for Age UK, Hillingdon, Harrow and Brent. So myself and Sally have been invited along to today's meeting, but we pulled together some slides representing the work not just of our own charities, but also of the partners that we work with through Hillingdon for All. And I take it that most of you will know about Hillingdon for All, but just for reminder's sake, Hillingdon for All is made up of the five of the larger charities in the borough. So that's Age UK, Hillingdon, Harrow and Brent, Hillingdon Carers, Dash, which is a charity supporting people with disabilities, Harlington Hospice, and Hillingdon Mind as well. And as well as those five main charities, we've expanded and developed as a partnership in recent years to incorporate a wider number of secondary partners involving a range of smaller charities that are also supporting residents within Hillingdon. So we pulled together some slides, which, as we said, we're not going to talk through, but just to give you a flavour of what the five sovereign charities have delivered during the pandemic, and also what we've done sort of collectively through the services that we provide through partnership through H4 as well. It would take me a long time to go through all of the services that we provide in business as usual, but to give us sort of a flavour, obviously Age UK provides a range of services supporting older people within the borough. That's face-to-face services, information and advice, befriending, hospital services, home care, etc. Harlington Hospice provides support for people at end of life. Hillingdon Carers, I'm sure Sally will expand on, but as it says on the tin, provide a range of services for people who are caring for people with any condition within the Borough of Hillingdon. Dash supports people with disabilities, and Mind provides a range of services to people with mental health as well. So we, the services that we provide in normal time is predominantly face-to-face, and a lot of what we do is around providing opportunities for socialisation and peer support for our various groups of residents with particular needs. And I suppose in terms of impact on us, that was probably the first part of our work which was impacted when we moved into the pandemic, in terms of things that we weren't able to deliver in the way that we have done previously. And that has largely been the case throughout, is that a lot of our face-to-face sort of building-based group activities have largely been suspended through the duration. We found some ways around that where in sort of, in certain limited conditions, we can still provide some group services, but largely that's been reduced quite significantly. What I wanted to focus on really is the impact on the residents, because one thing that we do as a group of charities is support the residents of Hillingdon, and that's probably the one thing that we have in common with the local authority and also with health. And we work very, very closely. We're funded and work very much in partnership with the local authority and the NHS in terms of supporting the more vulnerable residents within Hillingdon. And really, we rallied together very much as a group of charities, and rallied with the local authority and with the NHS in response to the pandemic. And if you cast your minds back, you'll recall in the early days, we were all sort of very much thinking on our feet and dealing with very immediate needs. And for us as a group of charities, we were looking at the more vulnerable residents of the borough who were struggling just with the basic necessities of day-to-day living. And that was in terms of access to food and access to medicines. And we work with people who were shielding or were classified as people who were instructed by the guidance from the government to stay at home. And at the same time that those people were instructed to stay at home, we saw the supermarket shelves emptying. We saw people not able to get to their GPs, not able to get to the chemist, and the chemists' pharmacies not able to respond and do home deliveries. The supermarkets weren't able to do internet shopping. So there was a big gap really in terms of meeting the very immediate demand of the residents. And we pulled together as a group of charities, and we really were all hands on deck supporting those very immediate needs. And we work very closely with the local authority. And I know that a number of the councillors around the table of this meeting room were also actually hands-on helping as well. We really were. We did all muck in together during those early weeks. And I think we did a fantastic job. It took us a little while to get ourselves organised, but there was certainly no shortage of goodwill really across the sector. And in the slides that we shared with you, we just gave you some of the high-level numbers, just so that you sort of get a sense of the scale of some of those operations in early day. But even those, I know, are an underrepresentation of what we were doing, because in those early days, staff and volunteers weren't going back to the office and filling in the record sheets for how, we were just responding. The phones were going, and we were out there responding to those immediate needs. I think what happened and what's evolved really, we went through that period. We managed to get ourselves organised actually incredibly quickly, particularly working with the local authority around food deliveries, food parcels, and also shopping services, which were delivered out of the Middlesex suite. And we organised and mobilised a team of volunteers. They were working very closely with the local authority call centre, and very, very quickly, really in a matter of days and weeks, we had systems in place where we were able to respond very, very quickly to calls for help and for support. And largely we were able to give people shopping services where they needed it, but if it was an emergency, we could get food parcels out to people. So I'm reasonably confident that nobody really struggled or went without during those early days as a response, largely as a response of the charities and statutory services coming together and just doing the best that we could. What did happen? Things have evolved since that time. I think the way that I think now we've had a chance to step back and reflect a little bit. We see this as very much two phases of operations from the sector perspective and also from statutory providers. And that first phase was very much a reactive phase where we were just responding to very immediate needs to manage people's basic nutritional and well-being needs. What we've seen evolving then is sort of more entrenched needs and impact of the pandemic, and particularly on the more vulnerable residents that we support as a group of charities. And I know that within the call centre and the local authority, you're seeing a similar sort of pattern, that the calls that are starting to come in are more complex. Some of the issues that people are facing are more complex as well. So we're seeing the same things with our service provision, which is largely phone-based, internet-based. We're getting people calling in who are lonely, who are isolated, who are really beginning to struggle because they've been at home on their own without social contact for a long time, and even where we had restrictions relaxing a little bit during the summer for a lot of people, and certainly the people that we support through Age UK, a lot of older people didn't leave their homes. They stayed at home. They were either fearful of infection or that they simply lost confidence to go out and about. And that is the case for vulnerable people in people with disabilities and learning disabilities as well. So other vulnerable groups have been in a similar position where they have been largely confined to their home for some months now. They've had very limited contact with friends and family. And for many of us, as we are today, many of us have moved to communicating over the internet. But what we have found is where people don't have access to the internet, they're even more excluded from society than they were previously, and it really exacerbates some of the sort of challenges that we're all facing living through this current pandemic. Some of the other things that we're seeing is we're definitely seeing an impact on people's mental health and well-being, and the sort of calls that we're getting are people who are experiencing low levels of depression, and a lot of people who are experiencing anxiety that is manifesting in a range of different ways as well. And as a group of charities, we've been looking at developing our services in terms of thinking through how we can respond to some of those more complex social needs. We're also seeing people's physical health deteriorating as well. So particularly where people aren't able to get out and about as much as they were, where they're not socializing, where they're not perhaps joining some of the social exercise classes that they used to. We're seeing people's physical conditioning deteriorate as well. So we're looking at how we can work with people, how we can motivate people to stay active, how we can work with people and motivate them to stay connected with people as well. And we're looking at innovative ways to create circles of support via phone and via the internet as well, where that's possible. So I suppose that's sort of where we're at the moment. I think our concerns really are for our client cohorts going forward over the Christmas period. We've it's suddenly feeling like we're sort of moving into this cycle again. And I think for people who are on their own, who are isolated or lonely, the thought of facing Christmas without family, without contact with family or friends, or very limited contact is quite daunting. And people are looking ahead, looking to the spring, it feels quite a long way away. So it is, I think, quite a challenging time still. And I think Sally's going to go on to talk about the impact on the sector and on our charities, but certainly one of the things that we are seeing is the impact on our workforce. I think it's quite challenging for staff and for volunteers who are sort of taking a lot of this stuff on themselves. And because our staff and volunteers are working remotely and working from home, we're sort of, we're using our teams, we're using each other to try and support each other, to support the people that we're helping within the community. But again, we don't have those physical opportunities to come together. So again, I think that we're starting to feel some creaks and some strains within our workforces as well. So I'll stop there, but hopefully that just sort of gives you a flavour of the sort of the environment in which we're operating. And I'll pass over to Sally, who's going to talk a little bit more broadly about the impact on the sector of the pandemic.
Thank you, Julian. It's been interesting to see how the sector's almost polarised by what's been going on. So as the larger charities, we've been able to draw down quite significant resource. There's been a lot of short-term emergency grant funding available, and in the slides we sent, we've brought in over £1 million. £750,000 of that was hospice money to expand Sobel and hospice at home services. So it's not quite as grand as it sounds, but we have been able to draw down quite significant resource. Some of that has gone directly to residents. We've all given out quite a lot of hardship grants for our young carers. We've been able to provide laptops to support home education. And we've also been able to set up new services. So the care calling that Julian talked about. So all residents can have a social call daily if they want, weekly or whatever, so that they're not just being alone at home. And all the charities are providing that, as well as the central service from Itch for All. But what the money's also enabled us to do is invest in our own infrastructure, so our own IT. I think it's fair to say we don't spend a lot of money on IT. We push as much resource as we can to the front line, and that's the nature of the sector. But because we've had to equip staff to work from home, and we've had to find new ways of working, so Julian talked about a lot of online provision, we have now sort of been able to draw down resource from grant givers that we're investing in sector being able to respond, through IT. So I think the benefits to that are we are now geared up, and for wave 2, it's very easy to click a switch and we're all back to being able to provide all of that stuff that took us a while to develop during the first lockdown. And we have the whole team equipped for that home working. So we're all feeling fairly flush at the moment because there has been a lot of short-term funding. We are not anticipating that continuing, and we know that the next 2 to 3 years will see a huge impact on the amount of funding available to the sector. There will have to be some clawback by grant givers on some of that money that they've made available. And we're also seeing a real sort of clear change in focus in some of their funding programmes. So we believe that we will see a greater impact in terms of access to resources in the next 2 to 3 years. So the larger charities have fared very well, and they have been incredibly innovative. The staff teams never cease to amaze me with some of the provision that they've devised and been able to provide during the last few months. However, smaller charities and some of those micro groups that are grassroots groups in the hearts of our communities haven't had the capacity necessarily, or the skills or the ability to draw down those resources. And we're certainly seeing a whole range of smaller groups definitely at risk of disappearing. And we are really, really keen to see those survive, because they are the groups that work with some of the most excluded in our societies. Those little tiny groups that work in one small part of the borough with a particular cohort of the population, often with BME groups or others. So we are very, very keen to look at how we can support sector recovery. We do have, as H for All, a small external grant. So we have been doing some capacity building with those groups. Obviously, when we were responding in the first couple of months of the crisis, all that development activity was pulled in to support the development of the hub and the services we were providing directly to residents. But we were then able to, in the sort of second phase of the first lockdown, able to start revisiting some of the capacity building and support to the rest of the sector. It's limited, it's a small team, and it's short-term funding. And we believe for the future that we need to find some resource to maintain the vibrancy and the diversity of the voluntary sector in Hillingdon. We've just, we're very good at bringing in resources. We're very good at grant applications. We've just applied for £500,000 to try and help us to do that. But it's not in the bag. Obviously all this funding is very, very competitive, and we just have to hope that we can. But we will be certainly looking to apply for all sorts of funding to help the sector recover in some way. And I think that the final thing to say, and then Gillian and I will take questions, is that what we're trying to do now is really coordinate activity. So we're in a position where we have all our responses in place, all our services in place, and the equipment to do that. What we'd like to do now is to look at the 13,000 residents that were classed as needing shielding, and look at how we can risk stratify for them. So look at their needs, and through the work we do, work very closely with the GP Confederation, and obviously H for All has staff based in the Care Connection teams, is to work out those that might be most at risk and how we really target that sort of activity at those, and that's a certain priority for us moving forward. I think that's pretty much all I needed to say. I don't know if you had anything to add to that, Julian, or do we take questions?
No, let's take questions.
Yeah.
Lovely. Thank you both very much. Members, grateful if you can indicate. So first we have Councillor Dillon, and then following that, Councillor Goddard.
Thank you, Chairman. My question surrounds the smaller charities. So it's been established that obviously, primarily you took. It sounds bad the way I'm going to put it, but I apologise in advance. You kind of looked after your own funding first, and then you came on as a H for All and looked after the smaller charities. But you've conceded that the smaller charities are very, very important to everything that you do. And I think we'll all agree upon that. There's limited funding available for them, but could that limited funding, had we had a sort of a central body looking after them instead of organisations like yourselves, who also have to look after yourselves first and then go back and then try and help the others, had we had a central organisation, for instance, maybe at the council, trying to help find grants and things to help those smaller charities, would that have been beneficial at that time? Or because it's quite a lot of resource that's been taken up for you guys, even now, when you're so busy trying to look after what's possibly a second phase and beyond, you know what I mean? It's just, would we have been better off having a central council voluntary sector service that could have helped those smaller charities as well as yourselves?
I think it's fair to say that the team we have been very good at helping small organisations to draw down resources. And as larger charities, I mentor lots of emerging charities and have helped them with applications, and we kind of try to mentor them and help them as best we can. But the demands of the immediacy of resident needs did mean that we had to focus on both our own cohorts as 5 charities, cohorts of the population that we supported, plus the H for All services we were already providing, plus respond to the hub. So unfortunately, we did take, we weren't able to support those groups. Had there been a dedicated infrastructure support body, yes, I would imagine that there could have been significantly more resource brought into the borough, because there is plenty of money around and still available. And we're now working really, really hard to try and bring in, what's still around and, at the moment. So I would say potentially that it would have been better for the smaller groups had there been a central, or had we had a central team that were able to support them. I don't know if Julian, you agree with that. I mean, that's a personal opinion, I guess.
Yeah, and I think it is. I mean, I think we always, when H4 was created, it was created as a collaboration of the 5 charities, but we always had the ambition to develop out and to be more of a support mechanism, and our primary drive is to try and reduce and if possible eliminate competition within the voluntary sector, because we saw that as quite an unhealthy, we saw quite a lot of infighting, and it inhibited collaboration. So we've very much pushed against that, with and working together ourselves in collaboration, but taking that out to the wider sector, and we have been quite successful in that. So that there isn't a council of voluntary services in Hillingdon. There hasn't been for some years. I think our sense is that there is potentially a space for that sort of function, but maybe for that function to maybe be delivered in a slightly different way than the old classic council for voluntary services. But certainly there's a space there, we feel, to provide that extra level of resource for smaller organisations.
May I come back on that, Chairman?
Yes, you can. Yes.
Thank you. Great. What I said wasn't meant as a criticism, so I hope you don't see it. But I agree completely with you that and for the next 3, 4, 5, 6, 10 years possibly now, with so much money being spent, you guys are going to have to get as much funding as you can, and therefore looking after the other charities or trying to help. And H4L does do a good job, but you've got limited resources. It's 24 hours in a day. We all have to sleep at least 8 hours, some of us more. But I don't think there's enough resource for you guys to be able to do everything. And I welcome what you've just said, is that if you think there's a space for it, it would be great to get some suggestions on what you think that space should look like, because that's what we're looking at here. Is to how we can help you guys further. But so if you can elaborate on that, come back to Luke or the chairman, it would be fantastic for us as a committee to know what that looks like, and possibly have something like that included in our recommendations at some stage.
Thank you, Councillor Dillon. That's a lovely opportunity. Just to come back very quickly on that, we have funding through the City Bridge Trust. But we had to take that very targeted approach to that, because we can't be all things to all people. So the infrastructure support we're providing is very much about around population health and wellbeing. So how do we create a health and wellbeing alliance of smaller groups and organisations that are working together to improve population health and wellbeing? But obviously the voluntary sector is much bigger than just the health and wellbeing charities. And we certainly haven't given any consideration to date to those outside of that remit. What we're very good at as a sector, though, is scraping together resource and delivering a lot for that. So we have a small community development team funded through City Bridge Trust. We have just put in a corporate grant application for a council-facing development officer. So obviously, when that comes to decision by members, that might be something that could be fed into that. And we're certainly looking for other external funding. As I say, we've put in one application. We're just about to submit another to try and expand our capacity to provide that support. But we'd certainly love the opportunity to go away and talk to the executive and come back to you with some proposals. That would be great. Thank you.
Thank you very much. We'll move to Councillor Goddard. I just want to add, Kevin, at any point, if you want to come in to add the sort of the council current position or involvement from what we've had with the voluntary sector throughout this, then feel free as well. But I'll go to Councillor Goddard now.
Thank you, Chairman. I mean, clearly we are a matter of hours away from the next lockdown. Therefore, I'd be interested to know what you would consider as the major learning points coming out of the previous lockdown, both for yourselves in the voluntary sector and for the council, and what major elements would be different next time round. And I appreciate, there are circumstances that are quite different with the lockdown we're facing now as opposed to the one we encountered in March, and so perhaps an added element would be to think about what would happen with a different emergency next time around.
Julian, do you want to pick this one up? Or?
Yeah, I mean, I think the thing that is obviously going to be different. I mean, we've already, as a group of charities, we've done a range of scenario planning. We have our contingency plans in place, business continuity and risk assessment, and we actually, the pandemic was on there, although I don't think we ever quite imagined it would hit in the way that it did. We did have some plans in place. I think this time round we are not anticipating that we are going to need to massively get into food parcel delivery or shopping services or medication, because the market and the infrastructure is now well in place to support people in those areas. That there may be small elements of that. We might find ourselves doing bits of dog walking and what have you, again, to help out people who are at home shielding and isolating. But as I said earlier, I think for us, it's going to be more of the same. I think that the lockdown this time round has a bigger impact on those people who are working and who are well. For the people that we're supporting through our charity, it will continue to be more of the same, because there hasn't been the opportunity for people to access a lot of the support services in the way that they would like to. So for us, it's going to continue to be phone-based support, internet-based support. We're doing quite a lot of work in terms of trying to increase the number of people who are online. So we are piloting some work around that, where we're providing tablets, data-enabled tablets, and obviously PPE, volunteers and staff to go in to support people, to orientate them with equipment. But if we can get more people online, that can make a huge impact, with a relatively small upfront investment on an individual's well-being. But that's the sort of that's preparation we're doing, and we are really thinking around how we support people during the holiday period. We're anticipating that there will be more people whose anxiety levels and more people possibly moving into a level of crisis through these coming weeks, as we sort of have the normal seasonal impact on people's well-being in terms of short days, but that coupled with the fact that people are confined to their own homes. I don't know whether Sally, there's anything you wanted to add to that in terms of planning?
Yeah, I mean, I think one of the other learning points that Councillor Goddard asked about, one of the other learning points for us, Julian alluded to the fact that the staff teams were creaking a little bit with the amount of difficult conversations they've been having with residents. So we've been able to invest significantly in their development. So we've provided training to date for about 30 staff across the piece. We always open up our training across the sector to help people deal with conversations about end of life, death and dying, which is very, very difficult for them. We have another series of workshops online for that. So we're preparing the the frontline workforce to be better able to provide that immediate support. But through Hillingdon Mind, there's been an expansion of counselling services and access to psychotherapeutic support as well. They've had new investment to expand their services. And for unpaid carers, we've had a lot of carers needing help to provide care at home, end-of-life care at home. So we've been working with Michael Sobol House, Michael Sobol Hospice, and other providers through the End-of-Life Board to develop training for carers so that they're getting professional support to do all that sort of basic care, but also how to manage death and dying in the home. So we've had time to really look at some of the most severe impacts and prepare both the staff and our services to try and support those. So I think that's the only thing I would add to the learning that Julian mentioned.
Councillor Gard, did you wish to come back?
Further from me, thank you, Chairman.
Thank you. Councillor Brightman next, and then we'll go to Councillor Dillon again.
Thank you, Chairman. Firstly, can I say what a fantastic job you've done during the pandemic? The question I wanted to ask is, with regard to future investment, are you looking to invest in wearables, perhaps in partnership with the NHS, so that when people are at home, you can remotely monitor their, blood pressure, oximeter, diabetes? These things are all commercially available now, and I was wondering if you're exploring any avenues to perhaps make those available to the people that you're needing to help, which are obviously the most vulnerable.
I'll let Julian answer that one, but just very quickly, we did actually mobilise quite a significant group of volunteers to deliver pulse oximetry and other types of already available equipment on behalf of the hospital and the primary care networks. So we were able to support the health service to do that, and obviously we're very involved in the flu jab campaign now, etc. But in terms of assistive technology, that's a very big piece of work that is bigger than the voluntary sector. I think that to be able to have enough resource to invest in assistive technology needs a whole systems approach. We absolutely are supportive of it and can support it, in small ways. But I think it's bigger than just us.
Yeah, I'd support that, and it is. I mean, certainly our experience of assistive technology, it's not. The technology is great. It's there. It's the infrastructure behind the technology. It's about having the call centre that can respond and the systems in place to be able to respond if an alert is raised. And that's, as Sally said, the sector as doesn't have that infrastructure in place. So you do need to have that sitting behind the technology. That said, we are working very closely with primary care, who are evolving their way of delivering very, very quickly, and are moving to, certainly, again, it's dependent on online access, but GPs now are routinely doing online consultations over smartphones and devices, and are looking at moving more and more of their services to utilising technology, and we're obviously working very closely with them and with the support services that we provide alongside. Primary care to also utilise.
That all sounds very promising. I understand the GDPR problems and the coordination that's required behind, but I was thinking along the lines of the telecare system. If it was something that, but obviously the funding's required. I don't know if if any of the manufacturers have been approached to see whether they'd be willing to donate equipment. To get the ball rolling, just to prove a proof of concept. But I definitely think it's a direction of travel. Thank you very much.
I would support that. I think digital exclusion is one priority. We certainly know that's emerging from the crisis, but also digital technology. There is some quite significant investment across North West London in health apps, so that people have an app on their telephone that gives them access to a whole range of information and advice. I think it's called My Health Help Now or something. Julian, you'll know the name. I'm not very good with names, but I absolutely agree, Councillor Brightman. That it is the way forward, and something the system is very aware of, I'm sure.
Thank you. Councillor Dillon, and then we'll go to Kevin after.
Thank you, Chairman. Yeah, once again, it's around about digital technology, and the reality of what you just spoke about about 2 or 3 minutes ago was it's quite hard. Carers, people dying, elderly, very lonely, coming up to Christmas. Do we have an idea of those kind of the numbers of people that we're unable to reach at the moment, that don't have technology or access to the internet, and possibly how we can help them? As I said before, and you guys know more than I do, that we're in for this for a very long time. So what solutions are there out there that we can kind of help them to get through this period of loneliness and, God, helplessness, I suppose?
Julian, shall I go? We obviously have quite extensive social prescribing programmes that H4All deliver, as well as our sovereign charities. Obviously, for anybody that's plugged into our services, we do some of the nice stuff as well. We deliver Christmas presents and food hampers, and there's all sorts of things we do to tackle that. But in terms of a sort of systematic approach to trying to plug people into support that's available, we have a range of social prescribing programmes. So we have wellbeing support officers that are linked to the primary care networks and take referrals, usually directly from GPs, but anybody can refer into those services. And the whole purpose of our wellbeing support officers is to plug them into the support that's available in communities. So finding the most appropriate source or sources of support for those residents. So, you'd have to anticipate that any resident that uses GP service should, if they need it, be being referred to those sorts of services. So we have the infrastructure there in terms of support for those residents. It's just making sure that people are aware of them. I mean, we do get referrals now from all 46 GP practices in Hillingdon. We've established enough to have that throughput now. So I think I'm fairly confident that nobody should be sitting at home without knowing that that's available to them.
Yeah, I think just to kind of go back on your question about digital exclusion, I don't have the exact figures, but I think for Hillingdon it's roughly 5 or 6% of the population would be classified as digitally excluded, but there are different things sitting behind that. So some people have very, very narrow digital inclusion. They may just have a smartphone, just use WhatsApp or 1 or 2 things on their phone. There's people who are digitally excluded because of poverty, because they can't afford the data, they haven't got access to technology, and then there are those people who just have never learnt to use technology, are fearful of technology, etc. So it's around 5-6% is a rough ballpark. In older people, it's more like 20-25% of the population who are digitally excluded. Obviously, year on year, that percentage shrinks, because if you look at those under 70, far more of those have access to technology, and over 70 it's much higher. So it is something that over time will change, but at the same time technology is getting easier to engage with, and the way that the sort of interventions that we provide are quite different. We don't do the old silver surfers, sit in front of a keyboard learning how to use Microsoft Office. Obviously it's very, very different now, and what we found is the key really to engage older people is finding the hook, finding out what it is that will make technology attractive to them. And often it is a mechanism to enable contact with family, friends, or to access interests that may be particular to them, and showing them how technology can enrich their life. That can be the hook to help to engage them with it, normally something like a tablet that's fairly easy to use.
I receive, and I think the leader is also receiving a WhatsApp message from a councillor every day. I don't know if that's something that you guys can employ just to kind of perk people up, or even I was talking today to someone about Joe Wicks and how great he was over the COVID period, and the food recipes, the exercises, and just I said to the lady, he's also quite good to look at, but that also helped. But it helps in the whole well-being of a person, and it's just something that maybe somebody within your departments could employ something ingenious to try and perk people up. But my question is coming back to it, especially for elderly, loneliness. What would you estimate as by how many years could loneliness reduce life expectancy? Because that's quite key at the moment.
I used to sit on the board for the national campaign to end loneliness. Data changes all the time, and I think it's a very difficult thing to measure. Some research said it was equivalent to smoking 10 cigarettes a day. Other research that polled GP said at least 10 older people in waiting rooms at any one time in a practice were there because they were lonely, etc. But so there's a lot of research and a lot of data that's out there about levels of loneliness. Just coming back on the kind of enrichment piece, obviously the care calling has been a really critical factor, but I talked about how innovative the teams have been. So we've done things like pamper evenings where we deliver products and then a therapist will get 8 of them online, teach them how to do a hand massage, and then they finish up with a hot chocolate, and or we're doing Spanish classes. I'm sure Julian's team are doing the same. So we're young carers, we've got a young carers app, so they get messages all the time. So the teams are being incredibly innovative, and hopefully just some of the stats in the presentation we sent will give you an overview, but they're by no means exhaustive. And I've been incredibly impressed with just how creative the teams have been in terms of, that type of contact.
Yeah, absolutely.
Thank you very much. Kevin, can I bring you in now, please, to comment?
Thank you, Chairman. I just wanted to chip in with a couple of things. Firstly, just to remind the committee that the council does have a voluntary sector grants programme, which Sally's already mentioned briefly, but that does support a lot of smaller groups as well as larger groups. So I oversee a programme of probably about £2.5 million worth of grant funding through the grants programme, but also through the Leaders Older People's Initiative and through our dining centre programme. So there is support out there that the council offers. I certainly would agree with what Sally and Julian have said about some of the pressures that smaller groups are experiencing. We're hearing that too, particularly those that are perhaps depended upon an asset where they would have an income from that asset and need to completely re-engineer the whole approach to supporting their original objectives because they just can't do what they were doing before. And those groups, I think, are really struggling, particularly those that depend very heavily on volunteers, both in terms of their workforce, but also their governance. So the trustees are left wondering what to do as much as the people who want to do what they've always been doing. And I've had a number of conversations with groups like that. And as our guests have said, that there is an application which we are actively considering under the grants programme to see whether we can support capacity building to some extent to try and help those sorts of groups, because I don't think the answer is for them to apply for core grants, because I think the barrier would be too high. We do expect a certain amount of governance and business planning before groups are eligible for that sort of level of core grant. The second point I was going to make, which responded to Councillor Brightman's point, is just to remind the group that the council does support telecare for older people. It's available free for those who are over 75. So there is a route through to accessing telecare if people are interested in it, and then we could provide that through the council. That's all I wanted to add at the moment. Thanks.
Thank you very much. I'd just like to ask a question from, I guess, a partnerships perspective. Obviously, when this came along in March, I think it was probably a quick realization that groups needed to work together, potentially alongside the council. Can you just give us an inside view as to how that materialized? So effectively from you realizing that what you're being asked to do or what you do as a charity was suddenly going to grow significantly, exponentially, and how you then engaged with the council and what the council did to be able to support you through that.
It all started with a phone call from Councillor Puddifoot, and we then had direct access to regular contact, initially with the call centre and Kevin's team, to set up the systems and processes we needed. And then we after that, we had weekly calls with Jean Palmer and with Mike Talbot, who's on the call. I think Mike will back me up, and Kevin will back me up, that the first couple of weeks were just chaotic. You know, the volume of things we were trying to respond to, plus the size of the problem. I mean, just setting up emergency food parcels, for example. We had volunteers literally driving around supermarkets, filling their cars and trying to claim back the money for that, just to be able to put food parcels together. So it became very apparent that we needed the council's clout to establish a supply chain. So I think Jean and Mike actually physically visited supermarkets and got priority deliveries for the council, which, as small voluntary organisations, even collectively, we wouldn't have been able to secure. So I think it was really important that the council's ability to secure those relationships was brought into play, and also the staff capacity that they had to support the shopping service. We were having to pull staff from frontline services to try to do that until the volunteers were processed. Obviously, we had probably about 200 volunteers came forward, but we still have to think about resident safety and safeguarding, and we don't like to put volunteers out there until we've had some sort of processing, you know, and security that they're safe to do so in, you know. So the volunteers took a while. Once they'd been processed and we had them in place, it started running very smoothly. So we had the Middlesex suite staffed with some of our staff and a whole range of volunteers, and the council made sure that the food was there and available, and it started sort of fitting in very well. Council picked up the shopping services with staff that had been furloughed, I think, and they helped process the volunteers. So it all came together very quickly. It felt like a problem after problem for the first couple of weeks, I think, Julian, it's fair to say. We didn't have many hours off. However, we got there, and really for a large part of the lockdown, I think the hub was able to genuinely support people in need right across the borough, and you know, certainly we were responding to probably, I can't remember, hundreds of calls a week anyway. So it worked very well in the end. I don't know if Mike, you want to add anything to that? Oh, maybe he's having a cup of tea.
No, that's fine. I guess where I just wanted to ask. Oh, go on.
Yeah,
Mike,
Chair, I think I'd agree with Sally. I think the one thing that I took from it very much was we actually kind of had different strengths. We were very good, I think, as a council logistically, and I think we were able to. We were able to redeploy staff at very short notice because we had services that were unavailable. But then I think when we realised each other's strengths and we came together, I think that's when actually we were better than, I think, or bigger than the sum of the parts. Yeah. And so, yeah, I think the relationship built, and we did get to a point where it felt like we had it was organised in a very, very fluid way.
Thank you. And just to clarify, obviously that call was made fairly early on in the pandemic to work together and collaborate. Just to understand, was it an existing relationship, as in the people you from the voluntary sector and the council, was that already an existing relationship, or was that the start of it, that you really had the beginning of the interaction from March?
Oh, no, I think we certainly have long-standing relationship with the council. I sit on many groups, and well, we all do on all sorts of boards and things. I mean, for me, particularly supporting carers, the carer strategy group, I work very closely with many of the team there. We have a brilliant relationship and support from Kevin's team, Kevin and Carla. So we are very council facing in our services, and I think the relationships were already there. You know, that we probably touched different parts of the council a little bit, that perhaps for the contact centre we might not necessarily have had as much, you know, so there were different touch points, if you like, but No, I think we were already fairly good at working together, I would say, Julian, wouldn't you?
Yeah, absolutely. And I think that the fact that and then the fact that the council sort of turned to us as the first port of call really was a good sign of that existing relationship.
Yeah.
They knew that we were an obvious partner to support with through that period.
Okay, that's great. Thanks, Kevin. I'll just bring you back in, and then after that, Councillor Farley.
I was just going to agree. I thought when you asked was there an ongoing relationship, there clearly was. I work with Julian and Sally sort of daily almost really in terms of my role as head of voluntary sector partnerships. They're recipients of core grants, so we have a sort of an investment really which we work together on to try and support residents. So they were the logical place to go. So when we first had a conversation with the leader of the council, that was our recommendation really was, well, let's talk to Hillingdon for All to start with and see where it goes from there. But yeah, I agree with everything else that's been said about how chaotic it was at the beginning. We really didn't know what was likely to happen or what was expected. And as messages changed as they came to us from government as to what was expected of local authorities, then obviously we had to adjust what we'd agreed we would work with H for All to deliver. So it was very organic at the early days, very organic. Thanks.
Thanks very much. Councillor Farley.
Thank you, Mr. Chairman. We've got some difficult times coming with another lockdown. We've got homelessness, issues with employment, whether people will still have jobs in coming months to come. Is there anything on the agenda with the group to expand the coverage to additional charities that cover a wider range of issues coming out of COVID? Thank you.
Absolutely. So the funding we have from City Bridge Trust, we've created we're calling the Health and Wellbeing Alliance, Hillingdon Health and Wellbeing Alliance. That's around 45 groups and organisations from across Hillingdon, from all sorts of very specialist services, from different women's centre, autism, all sorts of very specialist support. Because whilst the five of us have a fairly extensive portfolio of support we provide, we don't do everything for everybody. So we absolutely are committed to that wider support of the sector and that wider coordination of activity, definitely. So as I say, we have 45 members of the Health and Wellbeing Alliance, and we have 11 health partners now that we work very, very closely with. And we plan to expand that over the next year.
Councillor Farley, anything you wanted to come back on around that?
Thank you. Yeah, I was just sort of looking for, obviously health and wellbeing is a big part of it, but it's sort of beyond sort of the extra things that come or have come from the COVID crisis. So it was more sort of looking at that, if that was sort of an extra step sort of to bring it out further into covering those areas as well. I was wondering whether or not you could sort of comment on in terms of the further on sort of the issue with carers, and with care homes, particularly because that's been a particular issue. I'm interested in the support that's can be given to those, because obviously carers, whether they're in the home or they're in care homes, have suffered quite badly with this, seeing a lot of their residents passing away because of this, and it's very upsetting. They get to know the residents very, very well. I was wondering what sort of extension on the slides do talk about the counselling for young carers, but I was wondering what sort of counselling and care is in place to support the people that actually really get to know their residents very, very well. Thank you.
Just need to differentiate between unpaid family carers, which is what we support, and care workers in care homes. So they're two discrete groups. In terms of care homes, there is a quite extensive multidisciplinary care home support team working across care homes, but that isn't something we're necessarily very closely involved in. But in terms of unpaid carers, We have a pilot setting off in 2 weeks' time of a programme of support to help carers not only learn the basic skills for caring for someone at end of life, it also has a psychotherapeutic element, so looking at grief, how it manifests, what a good death is, cultural differences. So we have a whole programme that we've agreed. That is being piloted, and we have the commitment from health professionals across the borough to continue that. The pilot is really for carers to feedback and tell us what was useful and what wasn't. So that will be a regular part of our calendar moving forward into 2021. Young carers, we have a 6-strong young carers team who have done incredible work with young people over the lockdown. We have quite an intensive family support service, which works very closely with really complex families, particularly those families where there is parental drug, alcohol or mental health issues, because we know those are the young children and young people that are most disadvantaged by their caring roles. So we work very intensely with them. We haven't stopped any face-to-face contact in that service. Staff have had PPE and they've been going into homes and things. We've worked very closely with schools, so we have had some of them were in schools because they had to be, and we have worked closely with pastoral staff to support them and to support their education. And we've also provided quite a lot of laptops for people young people to continue to study at home. In terms of psychological and counselling support, we don't have a young carers counselling service. We are dependent on CAMS and on other provision, so we do, but the staff team are incredibly skilled at the kind of emotional support. And because we have often young carers will stay with our service from the age of 5 up to 18 or even beyond, we have very, very long-standing relationships with a lot of families in the borough. So a lot of those children have a kind of trusted adult in the staff team. So we've been able to draw on those relationships to provide the support that they need. And just in terms of stats, there's estimated 2,500 young carers in the borough, and we supported 1,200 last year. So we're not hitting them all, but we're certainly hitting 50% of them and have very intensive support in place for them.
Yeah, I think just to add to that, the two hospices in our partnership as well provide a range of supports for people who are suffering bereavement, and that's not only to people passing through their services, but that's something that they've offered out and extended. And Steve has offered it to out to the sector, to staff and to volunteers as well. Has been the offer of counselling and support and training, because it's sort of recognised a lot more people are experiencing bereavement and struggling with that, maybe more than in normal circumstances as well. So we have sort of been looking at a sector about how we support each other through this period.
And the hospice offers a children's counselling service for young people that have been bereaved. It's not a generic counselling service, but it does offer bereavement support. We just talked earlier as well about mentoring smaller charities. I've helped both the Halo Foundation and the Angela Logan Foundation, which are both child bereavement and child support charities, to get their first funded posts. I help them with their applications. So the work we do to mentor and support charities is paying off in terms of we're expanding that offer and filling those gaps really where we didn't have provision prior to them joining us.
Thank you very much. I don't see anyone else indicating, but I'd like to give members a chance to indicate if anyone would like to ask anything further. No. So in the absence of that, I think it's also nice for us as councillors, elected members, to thank you for the work you've done, both with as charities collectively and also with all the residents across the borough. Thank you very much for your time tonight as well. It's been very useful for us, and I'm sure we'll hopefully use this constructively as we work through this review.
Thank you very much for having me.
Yeah. You're welcome. Thank you. And obviously feel you're welcome to leave the call now. Don't feel you wish to stay for our other items.
I think we'll say goodbye. Thank you very much.
Okay, thank you, Kevin. I don't know if you had anything you wanted to add further to the contribution from our witnesses this evening, but otherwise, you're welcome to leave as well.
I'm quite happy to leave if I may. Thank you.
Okay, yeah, fine. Thanks very much.
Thanks very much for your time. Cheers.
Okay, so that brings us to agenda item 6, which is going to come to us from Mike Talbot. So this is a past review update. This committee carried out a review into recruitment in Hillingdon, quite a thorough major review into how it was done at the time. I think this was undertaken in April 2017. That's when it went to cabinet, so it's probably done prior to that. Like I say, a thorough review. In the report, it identifies all the recommendations that were proposed and accepted, carried forward by cabinet. So I think in the report, Mike's put comments around how these recommendations have been implemented either to date or what the plan to do them is. So Mike, I don't know if there's anything you wanted to pick out of it. I'm not asking you to go through all of the report because, like I say, it's been circulated to members. But after that, and then if there's any questions people have on any specific pieces, happy to pick those up.
That's great. What I would like to highlight, I think, is a bit about the employment brand. I think where we are today compared to where we were 3 years ago, we're much more sophisticated at being able to describe what differentiates working for Hillingdon to working for another business or another council. And I think one of the interesting pieces was what we did a lot of focus group work with a partner company, asking our staff what they found to be stimulating about working for the organisation. And I just thought I'd just highlight those just to give you an overview of what a number of our social workers, our accountants and our professional workers in the business felt that Hillingdon offered that they hadn't experienced elsewhere or they felt was particularly strong. And it came to five things, really. I think the first one was there's a sense of accomplishment and achievement working for Hillingdon. There's a real sense that you can contribute to a greater good and to achieve things, no matter what level you work at. So that kind of professional achievement came across very strongly. There was also a feeling that there was a collective impact, and that while you work at Hillingdon, you really are part of something bigger, and you do work, and we do work in very strongly across silos at times. There was a feeling that working for Hillingdon it's a resourceful and progressive council, and that we challenge ourselves to be innovative and to think in different ways. There was a sense of diversity and that the organisation is dynamic because of the diversity, and diversity in the ways of approaches and the way that we think as well. And lastly, there was a real feeling that there was a support mechanism around, not just through management, through an organisational culture that actually supported professional development. And I think when we talk about our employment brand, I think in the report I emphasise some of the visuals and some of the project that will lead to our web pages looking different and our adverts looking different. But I thought I would just like to highlight that was the feeling of our staff, and that's what we were trying to, and that's what I suppose these are the things that we try to use to capture people who are in the marketplace who would find that an attractive organisation to join.
Thank you very much. Happy to open this up if anyone has any questions they wish to ask. No, I don't see. Mike, the one thing I just wanted to ask was obviously where we've now implemented a number of these recommendations, can you or have you in your role been able to notice any change in how we're actually doing in recruitment? Has it been successful? Do you think we're effectively recruiting or attracting a better quality of candidate than we were prior to these recommendations being introduced?
Yeah, I think there's a couple of things. I think we're getting much better response from the candidate experience coming through the process. I think one of our challenges was losing good candidates, and we are quicker at getting the candidate through the process and retaining them as opposed to losing them to a competitor. So I think, yeah, that definitely brings in a better standard of candidate. Interestingly, the other thing that's worked very well for us is different employability approaches. The one that will stand out for me is our apprenticeship scheme. That's having a very big impact on us as an organisation, and our apprentices are really pivotal talent pool that's allowing us to recruit. So apprentices are joining us, and over 50% of those are staying with us and moving on, beginning their career with us. So I think that's really strong. I think the other thing that's really key is the other customer we see from a HR perspective is the line managers. What we should be doing, obviously, is making the recruitment process easy for them so that they can focus on their day job and delivering the services that they're employed to do. And I do think that we're starting to get a lot of traction around better satisfaction from our managers as well.
Okay, great. Thanks very much. That sounds encouraging, and good to know that the recommendations that came through this committee, having been adopted, have now been put into use and having a positive impact on the council as a whole, but also people's jobs and careers.
Thank you.
Thank you very much. Brings us to agenda item 7, which is the forward plan. I don't know if anyone has any questions on this, but I would point out to everyone present the cabinet paper item in December cabinet, as well as the medium-term financial forecast. It also includes our financial assistance to Hillingdon's local voluntary organisation. So that pulls in a number of the parts that Kevin talked about in terms of the grants that we look to continue to provide. So I'm sure members will look at that when those papers come out. Anyone have any questions or comments on that? No, we take that as noted then. Thank you. And then agenda item 8 is our work programme. I think this is the same as the version that got amended as we discussed in the last meeting, which Luke kindly circulated out to us. So in the January meeting, we have our second round of witnesses for our review, the cabinet proposals, as well as information around all the crime and policing stuff. So that previous review, and then the additional items we've got around the alligating and antisocial behaviour during lockdown. So again, if there's anything specific that you want covered off in that, so particularly around the antisocial behaviour, Councillor Dinn, I know you've raised this. If there's anything specific you want them to make sure we get covered, if you want to send that to myself and or Luke, Democratic Services, we can make sure we try to have officers prepared for answers rather than them having to go away and then we get information at a later date, which might not be exactly what we're asking. So if there's specifics on that. So I think that's it for and then the next meeting is on the 12th of January. Anyone have any comments on that? No, lovely, I know that. Finally, then I just want to let note for the committee, I think members are aware of this being circulated. Luke is leaving us as an organisation from Democratic Services. He's been looking after this committee for a number of years, certainly since I've been chairing it. So I think on behalf of the committee, I just want to note our thanks to Luke for his work on this as well.
Thank you very much. That's very kind.
So with that, we can close the meeting. Thank you much, councillors. You can just remain online until it's confirmed that it's finished and safe for everyone to log off. Thank you.
Thank you, Chairman. I will just stop the live stream.